Your sugar test looks normal, but your doctor still asks for HbA1c. Why? Let us uncover this hidden secret. Today we will talk about one of the most important tests in diabetes care, the HbA1c test. This video is divided into three clear parts. One is what exactly HbA1c and how does it work. Second, why it is so important in diabetes diagnosis and treatment. And the last one, finally, does this test also have some drawbacks? So let us get started. Part 1. What is HbA1c? Inside our red blood cells, there is hemoglobin, the protein that carries oxygen. When sugar is present in our blood, it slowly attaches to this hemoglobin. This process is called glycation. The more sugar you have in your blood, the more glycated hemoglobin is formed. This is what we measure as HbA1c. Since red blood cells live for about 3 to 4 months, this test shows your average blood sugar of the past 2-3 months, not just today's sugar level. Example, if HbA1c is 7%, your average sugar is about 170 mg per deciliter. If it's 9%, your average sugar is roughly 212 mg per deciliter. So HbA1c tells us the bigger picture of your sugar control. Next, why is this test important? Now you may ask, why do we need this test when we can check blood sugar directly? The problem is sugar levels keep changing. It may be low in the morning, high after meals, and different on other days. Checking sugar once or twice can miss the full story. But HbA1c ignores these ups and downs. It gives a true average over months. That is why doctors use it for two major reasons. First is diagnosis of diabetes, normal below 5.7%, prediabetic 5.7 to 6.4%, and diabetes 6.5% or above. Why 6.5%? Because research shows that once HbA1c crosses this point, diabetes complications like eye damage, known as retinopathy, begin to appear. Second, monitoring treatment. After starting medicines or lifestyle changes, HbA1c helps us check if sugar control has improved. For most people, the goal is below 7%. For older people or those with heart or kidney issues, the target may be little higher, 7.5 to 8%. For young and otherwise healthy people, sometimes we aim for 6.5% or even lower. So HbA1c is called the gold standard for diabetes monitoring. Now, part 3 is limitations of HbA1c. But is HbA1c perfect? Not really. In some health conditions, the value can be misleading. For example, anemia, kidney disease, or certain blood disorders. It cannot tell if someone is having frequent low sugars, known as hypoglycemia. That is why we now have continuous glucose monitoring (CGM) system. These are small sensors worn on the arm or abdomen. They record your sugar every 15 minutes, 24/7 for up to 14 days. This way, we can see not only the average sugar, but also how often sugar goes too high or too low. HbA1c is a powerful test. It helps diagnose diabetes and track how well your treatment is working. But remember, it's not a complete picture. For advanced care, CGM is even better. Thank you for watching. If you found this video helpful, don't forget to like, share and subscribe for more health tips.